There's a big change coming to the way doctors in this country diagnose and treat obesity, and experts in the field say it's about time. New guidelines published today in the Canadian Medical Association Journal reflect substantial advances in the assessment and treatment of obesity and shift the focus toward improving health outcomes rather than weight loss alone. It's much more complex than just counting calories and getting more exercise. Experts say obesity is a complex chronic disease. And as Mike Drolet explains, the sooner that's recognized, the more people can be helped.
What's the best way to reduce? Eat plenty or starve yourself?
For as long as we've had ads, weight loss miracles have appeared to be just a pill away.
And these yummy low-carb bars.
Fad diets have come and gone, yet chronic obesity rates are rising.
What we've done up until this point hasn't worked. We've tried and tried and tried for years to shame and blame people into losing weight.
Ian Patton is one of those people. Before undergoing bariatric surgery 6 years ago, his heaviest weight was 360 pounds. Counting calories and dieting didn't work for him. And as someone who is researching obesity for his PhD, he knew what he was talking about.
So it was a bit weird for me because as I was going through and doing my PhD and going to conferences and stuff and talking, trying to lecture about obesity, I was standing there at my absolute biggest and sickest.
Until now, the Canadian guidelines have had doctors using BMI or body mass index as a way to calculate obesity, except BMI is deeply flawed because it only takes into account height and weight, ignoring everything that makes us unique, like muscle mass, race, and sex. For me to be considered healthy on the BMI scale, I'd have to lose 80 to 100 pounds. The new guidelines completely rethink how we address obesity. Counting calories has been replaced by a more detailed medical approach. There are now 3 pillars to treat obesity: weight loss medication, bariatric surgery, and cognitive behavioral therapy, which addresses the reasons behind a patient's weight gain. They're also declaring obesity a chronic relapsing disease, which the Canadian government has so far refused to do, and is critical for the way it's treated.
Any approach to obesity has to be a long-term approach in the same way that other chronic diseases have to have long-term approaches. So there are no quick fixes, and hopefully the guidelines are going to get more people to realize this.
And ultimately get more Canadians the medical help they need. Mike Drolet, Global News, Toronto.